You already know that in order to qualify for Medicare incentives, one requirement is that you send preventative care reminders and communicate with patients according to their preference. So that could be traditional mail, email, voicemail, or text. Let's explore how automating those communications can offer a distinct advantage to a medical practice. We'll start by comparing the workflow process for sending out preventative care reminders through traditional mail to the workflow process for automated electronic communications. You'll quickly add up the difference. The manual process begins by identifying patients using electronic health records. Then postcards have to be addressed and postage added. This task may take about 2 minutes to complete. If this person is paid $15 per hour, this task costs about 50 cents in labor. Then add $1.34 in printing and postage. If you want to actually get a response from patients, someone will have to follow up. Research shows it takes an average of 2.5 times to reach a patient by telephone. So, let's say someone spends 2.5 minutes following up. That results in labor costs of 62.5 cents. Then, you spend a couple of minutes with the patient making the appointment. So that's another 50 cents in labor. Then you manually document the contact because you will need that for attestation purposes. At about 2 minutes, that task costs another 50 cents. Then, as it gets closer to the actual appointment date, you will confirm the appointment, probably with another phone call. That's another 50 cents in labor. So far, in this manual process, you've spent almost $4 reminding, connecting with, and confirming one patient. Multiply that by 1,000 patients, and you can see how the costs quickly add up. Now, let's take a look at the electronic process. It begins in the same way as the manual process, by identifying patients using electronic health records. Since you've already set up the workflow for the automatic notifications, the preventative care reminder messages are delivered without human intervention. This is done using one or more communication options based on the patient's preference, including emails, recorded voice, text messaging, or a default setting of your choice. So, no labor costs are involved. Next, the patient will call the office to make the appointment. So, let's say it takes an average of 2 minutes to make that appointment. That's 50 cents in labor. Then the contact is automatically documented within the system, so you have that data for attestation purposes. As it gets closer to the actual appointment date, the system automatically sends out an appointment reminder with a confirmation feature. If the patient confirms the appointment, nothing more needs to be done. In the electronic process, you've spent 50 cents reminding, connecting with, and confirming one patient versus almost $4 with the manual process. Multiply that by 1,000 patients, and you've spent $500 versus almost $4,000. With the electronic automated process, you save almost $3,500 per 1,000 patients. If saving money is not enough of a reason, consider the actual effectiveness of the preventative care reminders. With an automated system, you can track who requested an appointment and follow up with those who didn't. Still think the patients will prefer letters? Try the automated messaging first. Then send letters to only those who don't respond to the automated messages. Your costs for doing that will still be a lot lower than mailing everybody, and your effectiveness in getting them to schedule will certainly be higher. Call us now to learn more and schedule a demo.